Start.
Alright, this is the periprosthetic plating system from Zimmer. This would be called in on a weekend or during the week if a patient fractures above or below a hip stem or a knee stem. Two pans would be coming in with this system. You'd have to call your rep or the call pager. Two pans would be coming in. One will be just plate pans, the other will be strictly instruments. The plate pan itself is labeled left side over here, right side over here. The distal plates are for your distal femur. The plates on the top of the pan are for your proximal femur. And then there are 3 banana-sized plates just for midshaft fractures. These plates are all titanium and will need to be used if cables are involved with the cobalt chrome circlage cable with crimp. So it has a red dot on the box. Instrumentation is pretty straightforward with this set. Screws are going to be all over here. There'll be 2 levels of instruments. The main drill bit you'll need to know is the 4-3 drill bit, as well as the 4-3 drill guide, and it will be labeled 4-3 right here. Those are going to go with your 5-0 screws. Okay. If for some reason you cannot get a 5-0 screw in around the cement mantle in a hip prosthesis, you can use a 4-0 screw. These are also in the pan, and that will be used with the 3.3 drill bit as well as the 3.3 soft tissue guide. It's important to always hand the doctor the soft tissue guide because it sits within the hole of the plate. What's unique about the plate is that there's 30 degrees of movement and you can angle the screw in any direction. So as long as the soft tissue protector is in the hole and doesn't pop out, you can angle your screw and your drill bit in that direction. So it will be just like your basic screw procedure. So you drill, you measure, and then you go right ahead and you use the wood-handled screwdriver for any of the screws in the set. There also is a power adapter, however there is not a torque limiter within the set. So if you have one wrap separate or a different pan you want to use, feel free. It is a Jacobs Quick Connect chuck. Also a unique system, or a feature about this system, is that all the screws that go into the plate are compression screws or regular screws. Now the doctor will ask, how do I lock the screw in the position I want? There's a little tray that slides on the side of the pan. You slide the cover in, and there will be these little locking caps in the set. When you put the locking caps on, you have to use the blue screwdriver because it is torque limiting, and you want to stab the locking cap on the top of the dome. When the tray gets washed, the caps flip over, so it's kind of cup side up. When they go into the plate, you want to stab the top of the locking cap on the dome, and then it's able to thread right into the top of the plate. You can twist until it pops, and that will release your torque limiting. Another question they might ask is there a joystick in the set that will allow the doctor to push the plate up or under the soft tissue? In the pan there's this goofy little guide pin guide, and it does screw right into the plate, engages in the holes, and you can use that as a joystick to maneuver your plate around. During a case, if there is a thick cement mantle and you're having problems with the drill bit penetrating the cement mantle, the second level of the tray has gold tip drill bits, which are coated to break through the cement mantle better. A lot of times if you just hydrate the regular drill bit, it will go through, but if they are really struggling, there are sets drill bits underneath. The doctor does ask about plate bending. There's 2 little pieces in the second level of the pan as well. You'll have to pull your tabletop plate bender, and this piece will screw onto the bottom, and this will go on the top and it'll sandwich your plate. It's the big tabletop push bender. Another thing too is when you call your rep, if they do want to use cables around these plates, there's a separate box that will be sterilely wrapped. They're called cable buttons. They look like these locking caps, but they have like a little loop on the top that you'll thread the cable button into the threaded holes like the locking cap, and then wrap the cable through the loop and then around the patient. So those will be coming in with the set, but those will be wrapped separate along with the cables. And that's pretty much your set.